All right, good morning, all. Welcome to our pre-proposal conference for our 2023 Power Funding Opportunities, starting bright and early at 9 a.m. this Thursday morning. So we will feel free to introduce yourselves in the chat. Let us know where you work and your name and your preferred pronouns if you are comfortable with that. And we will turn it over to McLean to kick us off.
Good morning, everybody. I'm McLean Bryant-Macklin. I'm the VP of Policy and Impact at Health Forward, and it is a pleasure to see so many different organizations represented in this pre-proposal conference today. We know that many of you feel as though we are in precarious times, not knowing what opportunities will exist at Health Forward this year and beyond. And so we are pleased to roll out our first set of RFP opportunities to you all today, both of which are centered in our power work. Hopefully you all have had a chance to look at our purpose plan, which lives on our website, but we will get into that into some more detail later on this morning, just for some level setting. But my job today is to get us all sort of grounded in this morning, starting with some Zoom tips. Next slide. All right, these should all be second nature by now, but as we've learned, they aren't. And so we ask that you please edit your name to include your full name and the organization that you're with. In the participation list, you can just right-click on your name and select the rename option and then add that information. We also ask that you please keep your audio muted until we ask for questions. There will be time for Q&A during which we will solicit those questions. You can also, at your leisure, just input questions in the chat and we'll be monitoring those and then we'll address those during those Q&A periods. We also suggest that you change your view to speaker view so that you have a better sort of line of sight to the slides and the folks that will be presenting to you all this morning. And that we just wanted to let you all know that we will be sharing these PowerPoint slides. So please know that. They'll be shared on the website. We'll have this recording on the website as well, but the slides will be shared during the course of this presentation as well. So please maximize the slides and follow along as we are speaking. Next slide, please. Next slide. There we go. All right, so our agenda for this morning, we are going to cover a couple of RFP opportunities, which are pretty closely aligned, both existing in our power space. And so we'll start the morning with some additional context about our new purpose plan and strategy. We'll then get into the meat of the first RFP opportunity, which is around civic engagement. We'll then preview the application process and the grant awards that we have in mind. And then we'll round that out with some Q&A. Following that, we'll get into the second opportunity, which is focused on advocacy coalition building and support, followed by a review of our policy agenda, just so that you understand the sorts of advocacy coalitions and issues that we're looking to support with this grant opportunity. And then we'll round that out with Q&A as well. Next slide. And so with us today from the Health Forward team are the folks that have been working to bring these opportunities to you. Myself, Jason Williams, who is the Principal Impact Strategist for our Power area. Shannon Morris is an Impact Strategist for Power, as is Corey Seitz, and Nathan Madden, who is an Impact Strategist on our policy team. And you'll hear from each of them this morning during the course of this presentation. And I will now turn it over to Jason to orient us around our purpose plan and strategies.
Okay, good morning. Needed to get off mute there. Good morning to you all. I am going to talk to you a little bit about the Health Forward strategies and how we arrived at those strategies this morning prior to going into the information that I know you all are here for related to the specific RFP. So Health Forward 2 years ago embarked on a purpose alignment journey, which is similar to how you might think about strategic planning. And our purpose alignment process landed us where we hope to see ourselves over the next 5 to 10 years in terms of achieving impact in our community. Our purpose statement: every day we work to support and build inclusive, powerful, and healthy communities characterized by racial equity and economically just systems. That's our North Star. And so next slide, please. As you think about that purpose statement as a North Star, this is really an illustration of how we intend to get there with community. And so we intend to look at 4 different purpose areas, and I'm going to give a brief overview of what each of those purpose areas will focus on before a deep dive specifically into the power focus area, which we're here to talk about an RFP related to today. So first, we have our people focus area, where the strategies for the people focus area focus on whole person care, culturally responsive care, a diverse workforce, innovation, and infrastructure that center equity. Our people strategy is where you'll see some of our traditional work related to our mental health efforts and our safety net efforts. You'll see some of those traditional efforts recast in our people focus area. Then we have our place focus area. Place focuses on our affordable housing strategy and our strategy related to digital equity. And then our platform strategy that focuses on advancing racial equity and economic justice and narrative change to support health equity, race equity, and economic justice. And last, before we go on to the next slide, we'll talk a little bit about our power focus area. So the power focus area is where you see the civic engagement RFP. And on our purpose alignment journey, we really saw the opportunity to make the connection between health and civic participation. I think several of us on this call realize that there is a connection between those that participate in voting and organizing and all the things related to civic participation and health outcomes. And we really highlighted that as a strategy in our 5-year purpose plan. Second, the power focus area will focus on strengthening the capacity of small grassroots organizations, particularly those led by people of color and in rural communities. Next slide. The specific strategies related to the power focus area: advanced capacity building, leadership development, and connectedness, advanced participation in democracy, support community-driven efforts to redistribute and share power. Those are the strategies and the outcomes that we hope to see: stronger, more effective community-based organizations and leaders, increased effectiveness of community organizing and civic participation, increased community voice and shared power in philanthropic decisions. So within the power focus area, we really understand that those are hoping to understand that those who are closest to the problem are closest to the solution, and hope to engage community members in the decisions that philanthropy makes about funding, about strategy, about how we support and wield our own power as a philanthropic entity. And so in that, realizing that grassroots organizations play a critical role in that, we are going to be looking at how we can support not only with grant dollars, but with dollars beyond just those grants and capacity building and wraparound support, how we can support small grassroots organizations. In addition to that, in 2019, some of you may remember, we released a policy and civic engagement RFP, where we funded organizations who were working in that policy and civic engagement space, saw real impact in that RFP, and continuing that work moving forward through our civic engagement efforts and how we work with organizations who are organizing and registering voters and advocating for and against issues that may be opportunities or harmful in community, and how we support those organizations through our efforts to support organizations that are looking to advance participation in democracy. Next slide. This information has not changed. The Health Forward Service area in Kansas includes 3 counties: Allen County, Johnson County, and Wyandotte County. And in Missouri, Cass County, Jackson, Lafayette, Kansas City, Missouri, including portions of Clay and Platte County. Next slide. You'll see language in the RFP, you'll see language on our website, and you'll hear Health Forward continuously talk about in your consultation sessions. And as you're talking with Health Forward staff and community, you'll hear us reference our communities of focus. Our communities of focus are what you see highlighted on the screen: people of color whose outcomes are shaped by structural racism and other socioeconomic conditions, people in rural areas where systematic barriers hinder optimal health. That's what we mean when we say communities of focus. So again, that's language that you'll see in the RFP. It's language that you'll see on the website. It's language that you'll hear from Health Forward staff. And so just kind of centering on a definition for when you hear that language about communities of focus, this is what we mean. Next slide. Trust-based philanthropy. And so as we've gone and embarked on our journey of identifying purpose within the last 2 years, we've done that listening to a lot of community voices. We held several convenings, we had surveys, we had individual conversations in community. So a lot of community engagement related to developing that purpose plan. And what we learned is that as a foundation, we need to lean into the concept of trust-based philanthropy and some of the ways that that looks. Multi-year unrestricted funding opportunities for organizations, doing the homework on those organizations and doing the homework on some of the issues in communities so that we know where to put our funding, simplifying and streamline paperwork. So as some of you all who are grantees may be familiar, we've already streamlined our applications quite a bit, but continuing on that journey to make that process as least burdensome as possible on the grantee. Be transparent and responsive, solicit and act on feedback, and offer support beyond the check. Again, I referenced that grant dollars will always be there as a foundation, will be a grant making foundation, but how we can support organizations beyond just those grants with technical assistance and capacity building support is something that we're looking at throughout the entire organization, not just the power focus area, but in how we intend to achieve impact, looking at how we can support beyond the check. So some of the steps that you see on the screen around streamlining the applications, being responsive. If you read the invitation that went out for the RFP, we actually encouraged everyone who wanted to apply for this RFP to have a conversation with an impact strategist, because we want to hear from you about what's working and what's not working in the work that you do in community. And that's part of us leaning into the learning around trust-based philanthropy. Next slide. All right, so moving on to the opportunity itself that we are here to discuss, we are going to pass on to Corey, who has led us in the development of this RFP, and just want to shout her out for doing a great job leading us in the development of this effort. She has worked day and night, literally, so didn't want to miss the opportunity to kind of shout Corey out for leading us in this effort. Thank you.
Thank you, Jason. And that's a good reminder. I want to point out a couple of team members who aren't speaking today, but are being a huge help to us for this conference today. Alicia Rujo is helping us manage our chat and all of the questions that we are likely to get from you all. And Ross Jensby on our communication team is helping with the technical side and our presentation. So grateful to them and all of the team members behind the scenes who have helped get these off the ground. So we'll turn our attention now to the first of our 2 open funding opportunities related to civic engagement. We hope you had a chance to review those. They are on our website. I've dropped the links in the chat, and I will do so again later so that you can pull those up if you haven't yet. And we'll start off, next slide, thank you. We'll start off with a quick poll just to rate your organization's level of civic engagement work. Where are you at with it? Is it second nature to you? Is it central to your work? Is it something you're just starting to look at as an organization? Just curious where everyone lands kind of on that spectrum. We'll give just a few more seconds. The responses are coming in. It's really fun to watch behind the scenes as second by second more come in. Okay, I'll go ahead and end it so that you can just see the results of that. So really, there's people along the entire continuum, quite a few tens, folks who are really embedded in this work. A lot of folks kind of in that mid-range too. So doing quite a bit of the work, and folks just getting started, which is wonderful. So thank you for sharing that with us. We appreciate it. And next slide, please. So when we think about What is civic engagement? There's a lot of different ways you could frame that work, but to us, the definition we're using and the framework we are going to use to make funding decisions is that civic engagement encompasses a broad range of activities related to democracy. Hold on, let me check and mute a couple of guests here. Okay. It is work that is related to democracy, from donating to charity to voting. It's a strategy and an outcome that fosters social cohesion and amplifies the power of citizens by aggregating individual voices. Community members are most effective in solving problems and holding institutions accountable when they act collectively. So for us, this ties back to democracy, our political system, the power structures that shape all of our lives. Next slide, please. And when we think about, Health Forward is a health foundation. So why are we interested in civic engagement? We certainly acknowledge that civic engagement is one of many social factors that influence the health of people and communities. And there's strong evidence of a bidirectional relationship between health and civic participation. And to give you just a couple examples of what we mean by this, these are some of the reasons that in June of 2022, the American Medical Association acknowledged voting as a social determinant of health because of that relationship. So we know that people are more likely to report fair or poor health in states where there are below average voter turnout. We know that even after controlling for different demographic factors, individuals with higher levels of political activism also reported higher levels of personal well-being. And we know that studies have shown that voter participation is associated with better self-reported health. Next slide, please. We also know that civic engagement is a form of social connection that has a positive impact on our lives in a lot of different areas. It's a form of social connection that creates a positive feedback loop for social, emotional, and physical well-being. And voting is also an opportunity to exert your voice and establish a path to health through empowerment. Next slide, please. Oh, sorry, my computer screen is here we are. About this funding opportunity, Health Forward will award up to $3 million through this grant round, and those dollars will be distributed in 2023 and 2024. It's important to note we will not have another open civic engagement round in 2024. So 2023 is your opportunity for the next 2 years. Next slide, please. So we are going to fund specific civic engagement and community organizing activities. This is not an exhaustive list, but these are a number of the key activities we'll be looking for. So, some things are pretty self-explanatory, getting people signed up to vote, getting people registered to vote, mobilizing voters, getting people out to vote, as well as educating them about different policy issues, although not candidates, policy issues that impact the community. And when we talk about community organizing, again, we have a definition of what this means to us at Health Forward, and it's a process of building power through collective action in order to advance shared interest. It is a method of engaging and empowering people with the purpose of increasing the influence of groups historically underrepresented in policies and decision-making that affect their lives to achieve desired goals in their social, political, economic, and physical environments. We are also interested in funding messaging, communications, and research on specific policy issues. So things like white papers, things like communications campaigns around specific issues, research and evaluation on the impact of certain policies. We know that this work is also really important to having a civically engaged community. And these all tie back to Health Forward's policy agenda, which we will talk about in more detail later. And we will drop those links in the chat as well. Next slide, please. Who should apply? The funding opportunity document includes a long list of who could be a fit for this opportunity. Things like organizing organizations advocating for or working against specific legislation in Kansas and Missouri, organizations doing voter registration, organizations wanting to grow their capacity to do policy and advocacy work, etc. I won't go through the whole list, but just be aware that that list is just examples. It's not exhaustive, but we wanted to give some ways that you might see yourself doing this work. And again, please talk to us about your ideas so we can better understand your fit and help lead you in the right direction and just know more about your work. I think the overarching thing to consider when thinking about are we a good fit for this opportunity is your alignment with both our civic engagement activities, our policy agenda, and our communities of focus. We'll also be looking for a strong track record and connection with the communities you serve. That will be taken into consideration. So if your organization is newer to this work and looking to launch something new, tell us why you're ready and why that makes sense for the direction of your organization, given your mission and the work you're already doing. Next slide, please. In terms of desired impact of this funding opportunity, we believe that civic engagement is a powerful tool, and we want to support the increased effectiveness, scale, and participation. So while our theory of change outlines specific outcomes we're looking for, we also plan to collaborate directly with the grantees that we fund through this opportunity to make a plan of how to identify meaningful ways to understand our impact together. And this is different than our previous approach to evaluation that perhaps included a lot of specific metrics we were looking for. And we really want that to be an equitable approach to evaluation and something that is collaborative in nature going forward. Next slide, please. Okay, we will now move into the nuts and bolts of the funding application process. And this, just so you know, this is applicable to both the civic engagement opportunity and the advocacy coalitions opportunity that you will hear about in a little while. And these are the key dates to be aware of. While our previous process included a letter of intent that was essentially a placeholder, anyone who submitted a letter of intent would be invited to submit a full proposal. We do want to draw attention to the fact that the process is different now. And so the letter of intent is something that will be reviewed and likely we'll talk to you about it. And then some of those organizations will be invited to move forward in our process. This is for a number of reasons. Our resources are limited and we unfortunately won't be able to fund every great proposal that comes our way. And we want to be transparent and respectful of your time and resources. So if we have to say no, we want to say no as soon as possible and not have you invest time and energy into writing a proposal that we can't fund. So that is the reason for that change. Know that after we receive your LOI, we may reach out to you with questions and for additional information, and that's not a bad sign. That's just us wanting to better understand your work. So based on that letter of intent, we will send out invitations for additional information by May 1st. And this isn't necessarily it's not going to be an application that looks similar to our previous applications. It's we're really trying to be more focused in the information we're collecting and really asking for just what we need to both make funding decisions and to plan for our collaborative work together once grants are made. So any additional information will be due by noon on May 31st. And then after additional internal review, grants will be awarded in early July. Next slide, please. I wanted to draw your attention to this consultation request form on our beautiful new website that our communications team has been working on. So really you can go in there. It's a brief form. It just asks for some simple information about what you want to talk to us about. And it puts you in touch with someone on our team that we think is the best fit to talk to you. So if you're interested in applying, we hope that no one applies blind without talking to us about it first. And next slide, please. We do encourage you to review the eligibility guidelines on our website that are really for all of our rounds. And these are very similar to the past. Our non-discrimination policy, the fact that we can fund a 501c tax exempt organizations. If you haven't yet received that, you'll have to use a fiscal sponsor, and we are exploring different opportunities and options for that. So if you're in that boat, encourage you to talk to us sooner than later, just so we're aware. And in general, we cannot fund political campaigns or support or oppose candidates for office. And this is one difference. Priority is given to organizations in our service area. The prior rule was like you had to have an office in our service area. And however, we will also consider organizations that are perhaps housed elsewhere, but doing important work in our community and work that impacts our communities. Next slide, please. And specific to this application or this funding opportunity, we need to see you doing all of these things, focusing on our communities of focus, which includes people or groups that have historically been marginalized and excluded from power and political processes, organizations that are led by and or serving people of color, or organizations that are located in or serve rural communities. So again, focusing on our health forward service area and aligning with our policy agenda. Next slide, please. The letters of intent will be submitted in our portal. If you've applied with us in the past year or two, it's the same portal you've seen before, so that will look familiar. If you're a new applicant, you'll need to register for the portal. Templates will be available on our website within the next, early next week at the latest, and that will have detailed instructions on how to register if you need to. Additionally, once a year, you'll be prompted to complete or update demographic information for your organization. Since this is kind of our first funding round out of the gate under our new purpose plan, everyone will be asked to fill that out, but just know that you won't have to do that every time. It's a once a year activity. And of course, our grants administration team is available to help you if you have any trouble registering or getting back in and getting connected to your organization in our system. Next slide, please. So while the portal is the same, the questions will be different, and I'm just kind of going to talk you through some of the questions we'll be asking for the letter of intent. We have really tried to make it as streamlined as possible to make it as accessible as possible for different organizations. So you will be asked to enter a request amount. There's no cap on that amount. I'd say just be conscious of our dollars that we have available and the work you're doing and what you need to do that work. You can request a term of up to 24 months, and it is our intention to make most of these grants multi-year grants, so 2-year grants. And there may be situations where you would you have something specific you want to do that is only for a year. That's fine as well. Just know that you can apply for up to 24 months. We'll ask you what activities you're engaged in. It could be more than one of these. And you'll see Advocacy Coalition support is on there as well. So this is a single letter of intent that is applicable to both of the open funding opportunities. And if you select Advocacy Coalition support, that just indicates to us that you're interested in that funding opportunity as well. And again, if you're not sure, you need to talk to us about it, please feel free to reach out. Next slide, please. We will ask for some geographic information in terms of who you're working with, who's benefiting from your work, and this is consistent with how we've collected it in the past. So if you've applied to us before, this will feel familiar. But we kind of ask you to think about it in terms of percentage and what percentage of your work or impact is in these different counties that are part of our service area. And, you know, we know this is a little bit different than some of our grantees who maybe have patients. You know, if you're providing medical care, you know where the counties where those patients live. And this is a little bit different. So we know it'll be in some ways an educated guess, perhaps, and that's okay. And if your organization is doing statewide work outside of the counties that are part of our service area, just list that percentage in other counties so that we're aware of that as well. And ideally, your percentages add up to 100. And of course, we do expect any health forward funding to support work in our service areas. So it's fine for you to be doing statewide work and work in other counties, but health forward wants to see impact in our service area. Next slide, please. In terms of the narrative component or the storytelling that goes along with your letter of intent, if you are applying for civic engagement opportunity, these are the questions you'll answer, and advocacy coalitions as well. So, you know, these are meant to be, we're not looking for a 10 or 12-page application. We're looking for 2 or 3 pages that cover these 3 questions to really give us an understanding of your work. And so, again, we're really trying to get to the heart of the matter here. How do you align with this funding opportunity and our policy agenda? Tell us about your history and why you're connected to this work. Tell us about the communities you serve. Next slide, please. And if you are applying for Advocacy Coalition funding, you will be prompted to answer a couple more questions that are just really specific about that coalition work. So about the, you know, how that aligns with our policy agenda and who are the members of your coalition. And it is possible that we would make grant funding available from both of these to a single organization. We don't see that happening a lot. We don't see a lot of organizations that fit within both necessarily, but so if you think you do fit in both, please talk to us about that. But it is possible to apply for funding from both categories. And it's just filling out this single LOI to indicate interest in that. Again, we'll reach out if we have questions based on the responses you give us here. And the templates with, you know, the same information will be up on our website early next week and due on April 4th. And next slide, please. With that, I will turn it over to my colleague, Shannon Morris.
Okay, good morning, everybody. Gonna talk a little bit about the grant awards. Some of this information has been covered, but go ahead and share a few things with you. Next slide, please. The Health Forward team will internally review all the letters of intent and the information provided from the applicants. We will not be using external reviewers or anything like that. So this will all be done internally. We have built time in, and Corey referenced this. We have built some time in to reach out to you if we have any questions. This isn't a bad thing. It's just our desire to better understand your organization and your work. And I think this is another example of how we're becoming more flexible in terms of reviewing proposals and getting the information that we need. Funded partners will be notified in early July. So next slide, please. Corey covered this, but there will be no minimum or maximum threshold in terms of the ask. So ask what you feel like you need to do your project. Most grants will be 24 months, as Corey referenced. This is, again, going back to what Jason was sharing before. This is consistent with trust-based philanthropy. We are moving more towards multi-year funding. And so you can apply up to 24 months. Most will be unrestricted. There is a caveat to that. There will be some examples where we will ask that it will be restricted to purpose, the funding, and a good example of that is there's an organization that does a lot of things that's not specific to civic engagement. We would ask that our funding be specific to this civic engagement opportunities. So next slide, please. Okay, this is something that Jason referenced before in terms of support beyond the check. This is something that we're really champion and really prioritizing moving forward. And so 2023 Power grantees will have additional opportunities. And those will be co-designed with the grantee and with Health Forward. And so it's not a one size fits all. We'll have a discussion, assess what our offerings could be a benefit to your organization. These offerings could be trainings, networking. I do know that we do plan on providing some networking opportunities, technical assistance, contracted services, potentially with some consultants, learning cohorts, shared tools and technologies. Perhaps it's a online platform of some sort. So just wanted to share that's going to be an offering this year. Next slide. And with that, I think that we will open this up to questions.
I think we're scanning to see if any hands are raised. Please do raise your hand and then we can work to call on you if you have questions. I heard someone chime in though. Is there a question?
I was just going to respond to a question in the chat. When will slides be available? Later this week or early next week at the latest. And I see Janet Baker with her hand raised. Hop in there.
Thank you. Can you hear me?
Yes. Speak
Okay.
up though. You're a little soft.
All right, thank you. My question is, can we apply for our own advocacy work within an organization and be a part of a larger community collaboration as well? Or we need to select one or the other?
You can apply for both. We don't see that being a really common scenario necessarily. So among the coalitions doing work that relates to our, our policy agenda, our strategic plan and our priorities, think about, if you are the lead organization on that and you are also doing your own work related to voter engagement registration or advocacy. Yes, absolutely. We could potentially provide funding from both streams and any teammates hop in here. But we just encourage you to talk to us about that too, so that we have a good understanding.
Correct. We would work to come to that understanding during the conversations, sort of as we're arriving toward a decision on an award. And the intention behind the coalition support grant is to support the activities and organization backbone of the coalition itself. And the work of the coalition, knowing that that's made up of members, but the coalition has its own apparatus, often distinct from that of its members. And so that's the reason why we would consider potentially funding an individual organization that's a member of a coalition, and then also the coalition.
Thank you. I appreciate that.
I have a question.
Go ahead.
Are there any age restrictions or any restrictions on youth civic engagement?
No age restrictions, civic engagements for everyone. So, yeah.
Thank you.
Yeah. Yeah, those are lessons we need to learn early, right? We did get a question in the chat about does Health Fund just fund 501c3s? We do fund 501c4s. I don't know that we've funded C5s. Those are typically labor, agriculture, and horticultural organizations. So we'll probably have to look into that, but C4s, yes. Again, as long as it's within the allowed activities. We know that C4s do participate in activities that we can't fund, and that's fine. It's just a matter of how our dollars are used. And I see another good question from Janelle from the League of Women Voters. Does the process allow for formative assessment, which would allow for possible realignment of activity if goals are not being met or reached? Does the relationship with the program officer allow for supportive feedback collaboration? If I'm understanding your question, and feel free to jump off mute if you want to chime in, Janelle. I would say yes. We want to learn and grow and adapt with our grantees. And so we're certainly open to making shifts as shifts are needed. A formative assessment. I'd say, and teammates, feel free to jump in here. We're all in a process of learning, and I think it's as long as you have a range of activities that you're planning related to civic engagement, having a phase built in where you need to do an assessment and need to potentially adjust, I think is completely permissible and understandable. I'm not sure if I've answered your question, so jump in if I haven't.
No,
Okay.
you totally have. I think one more just question I had was, it sounds like there's a relationship built with the program officer at Health Forward Foundation that would allow for a feedback, we want to reach more new communities, which we're doing that work already, but we would love for it to be more robust, and getting feedback as to what platforms work best. Right now we're doing a lot of door to door, but could use a lot more input on maybe the program officer has ideas on success strategies. So I was just wondering how that back and forth works.
Yeah, I think you are touching on the kind of funder we want to be and the kind of relationships we want to have with our funded partners. So absolutely. And while I certainly can't claim to be an expert on all those things, we want to connect you with the expertise you do need to make good decisions and to grow as an organization. And so that's probably also connected to what Shannon talked about in terms of support beyond the check. So yes, we would love to be involved in that way as impact strategists and recognize that there will be opportunities for us to rely on external expertise as well.
And I'll just add one thing to that in terms of how our process has traditionally worked. Traditionally, grants have been 12 months, and even in a 24-month grant, there will be a process for which at the midway point of your grant, you'd have a check-in with your impact strategist to talk about where you are. And it's not uncommon to realign grant priorities based on what you learned early on for how that grant might finish. That's not something that's uncommon. I think I speak for all the impact strategists that we see it quite often, a realignment of priorities, a realignment of even potentially dollars based on what you learned as you got started with doing the work. And I think you make a great point for the opportunity for philanthropy, who often gets to take this 10,000-foot view of a lot of what's going on in a space to share back learnings for organizations who might be looking at different ideas. But one of the things we also intend to do is create a space for organizations to network and learn from one another, and not a formal program or not coming in and going through an agenda, but just creating space where organizations can come in and talk to another organization who may be doing similar work and what that can potentially look like. We just talked about that yesterday. So I think that's a great question, and really wanted to center that's one of the things that we're talking about in Support Beyond the Check, is how we can create spaces for networking and collaboration and purpose alignment for some of those organizations who are in the space.
And the only thing that I would add is, the role of the impact strategist. We're not, we're not coming from a place of compliance driven. And so we have a lot to learn. We have a lot to learn from you. And we are more than willing to be a thought partner with you. And if we can help facilitate what you need to fulfill what you're trying to accomplish, then that's a space that we welcome and would like to be a part of.
I think Billy had a question, if you want to go ahead and jump in.
Sure. Thank you so much. Can y'all hear me okay? Seeing heads nod. Okay, awesome. Bandwidth is a little crazy today. Pluses and echoes to note about building collaborative space and connections within this community of folks who are applying. I'm seeing a lot of some familiar faces, some folks who I only know by reputation, which is really cool. And so a lot of new faces but organizations doing great work. But anyway, Billy, he, him, and I appreciate the note about funding for C4 versus C3 organizations. But even if we are a C3 organization, or if it's a C4 organization with a fiscal sponsor, do these grants, can they be used to fund, I guess, what can be described as C4 work? A lot of folks who want to engage civically, especially locally, which we're very active in, especially in environmental justice, home health, and air quality, water quality. A lot of that ends up having to do, there ends up being the need for an ordinance to be passed, or like that's something that folks are very interested in accomplishing, even if they might be interested in work that could be considered C3 non-legislative. There is oftentimes an interest and a need for, especially in a region like ours, given the makeup of our state legislatures in Kansas and Missouri, need for some sort of legislative power building. And we want to be able to respond to our bases. Would this be able to fund that type of work?
I'll jump in. And anybody else who wants to piggyback, please feel free to. We are prohibited from, through the way we're set up, supporting or funding electoral or partisan activities. We can fund issue education and issue campaigns, but not anything that is candidate specific. That is our, pretty explicit bright line limitation, and where we draw the line for C4 activity.
Absolutely, totally understand that. And I guess, if there was an issue though, again, like if folks wanted to be educated, often some folks will be very concerned about if work will end up, like, for example, education around healthy homes. And folks are interested in need, like, oh, there's like a lacking of a policy initiative at a city level, say Kansas City is lacking. But in order to affect the policy, an ordinance would need to be passed, not an election, but just, educating about how folks can get involved, work with their communities. That would be okay with it. That would be in the purview of the grant.
Yes, so long as
Okay.
it's issue based.
Thank you.
You're welcome.
We have a question in the chat about environmental justice, alignment, and advocacy. Again, great question. Thank you for that. I want to point that the strategies that we will support need to align with, or should align with, the policy agenda. Environmental justice is outside of the scope of that current policy agenda, and so would not look for alignment within the environmental justice engagement and advocacy space. Next question. Health Forward has previously limited grants to municipalities like the city of Kansas City, Missouri, to 2 grants per year. Has that changed? KC Health Department may be a great fit in power, people, place, platform. I think that's a great question, and one that we may need to spend a little bit of time kind of speaking to. Our traditional process or our previous process saw open RFPs in healthy communities, mental health, safety net, and even some strategic initiatives. Health Forward has transitioned from that process, as you all may remember. And so while this is an open RFP, that isn't a signal that all 4 purpose areas will launch open RFPs in 2023. Using the people team as an example, they have worked tirelessly to develop a slate of organizations or to invite into an opportunity based on the impact the focus area hopes to see in the healthcare ecosystem, and work day and night to kind of develop that opportunity. That's more aligned with what you might think about as a closed funding opportunity as opposed to an open RFP opportunity. So should there be alignment with an open funding opportunity in power, and what an opportunity might look like in place later in 2023, as McLean alluded to, yes, there is potential that an organization such as yours may be doing work in both of those spaces. So the answer to that is yes, but wouldn't want to set the expectation that in 2023, 4 to 6 additional open RFPs are coming, as the work looks different than it has traditionally looked.
Just for some further clarification, we previously limited the number of applications that someone could submit on a single round, but not the number of grants we would make. And that I would think is the same moving forward, that yes, we would absolutely make multiple grants to an organization that fits and is doing work. But for this, and municipalities, there were a couple exceptions. Municipalities and universities were allowed to submit 2 applications to a single funding opportunity. And we, moving forward, encourage you to not to submit multiple applications to a single funding opportunity. We haven't made any formal changes to that rule, but would encourage you to talk to us and get really clear on your alignment. Yeah, I hope that's helpful. I think I saw another one come through chat here. Do we consider ballot measures, issue campaigns, or electoral work? We've certainly been very active on various ballot measures, ballot initiatives. So that is, if it aligns with our strategic plan and our policy agenda, no problem there. And there's a question as well about 501c6 organizations. I don't know that we've funded those, and we need to probably discuss that offline. And I see a question. Mong Sona, I'm probably mispronouncing your name, and I'm very sorry. Feel free to correct me and hop in.
No, you got my name right.
Oh, wonderful.
Yeah. We have been working with refugee population in Kansas City, Kansas. And I've been very active in the community and wanting people to learn a lot about the systems, including voting, around voting time. And, my questions are 2, would this grant support a new position who would focus on civic engagement is one, and the second is since we will be pretty much grassroots doing grassroots level work, we will need a lot of training materials. Would you be able to help us with that, providing training material for civic engagement? Thank you.
McLean, are you hopping?
Sorry, yeah, I'm here, and I missed that question. I got lost in the chat. Can you repeat the question, please?
Okay, my first question is, we work with a lot of refugee population here in Kansas City, Kansas, and I wonder if the grant will support a new position whose responsibility would be to engage different communities in this work, this project. And the other one is, since many of the people who work with are so new to American system, we will need a lot of training. We did a lot of training during the COVID, doing in different languages. And I can foresee ourselves doing the same thing again. And will there be materials for training, this kind of training? And will you be able to help us with finding the right speakers for the group?
So one of our slides detailed the sorts of work that we envision supporting in this particular RFP. One of those opportunities is around messaging, communications, materials, understanding that different levels of familiarity and comfort with, the English language, as an example, will require, some additional, training and materials. And so see an opportunity to apply for funding for what you mentioned in that. Also, in terms of the coalition support grant, which we have not yet gotten into, but we'll give some more detail on in just a few minutes. There will be support beyond the check offered within that opportunity, intended to, I guess, alleviate some of the financial need that comes with needing to message different messages to different communities that speak different languages as well. And invite anybody else to kind of piggyback on anything I might have missed.
I just want to point out that also Janelle from the League of Women Voters said they'd be happy to help talk to you about resources, which is great and exactly the kind of collaboration that we want to see from the cohort that we fund. So I think that there will be opportunities for that as well. So that's a yes.
And maintain oh, sorry, Gordon.
Oh, go ahead, Jason. I was just going to say, if there's any other aspect of your question we didn't answer, let us know.
Yeah, and to your first question, Health Forward, I think for those who have been grantees before can speak to, has always allowed for funding of positions and salary support and benefits related to that salary support. So in terms of an ask related to funding a position specifically related to civic engagement work, yes, your grant application can include an ask specific to a position. And just shout out to all of you all on the call who are already offering resources around how that potential position may be trained or supported in civic engagement efforts. And I think that you caught quite a bit of that in the chat. So thank you for that.
Yeah, and hiring a staff person to focus on this work, we know is often a step, organizations get to a point where they need to take that step. So that is, yeah, absolutely something we would fund.
All right.
If there are no more questions, I see an actual hand. Janelle?
I'm so sorry. I'm slow to the digital hand. I just had one more question. So we're an all volunteer organization. So I love hearing that there might be a possibility to request funding for a staff person. But I was wondering, we're just starting to collect metrics on our outreach and things like that. So I understand trust philanthropy doesn't necessarily depend on a metrics or a result oriented, or does it? I guess where does that fit into if you are awarded a grant? Because I'm assuming in the past, part of it was reporting your outreach and how you're doing, spending your money wisely.
I'm sorry, can I have that question one more time?
Oh, sure. I'm sorry. I was just wondering, with trust philanthropy, how does that work in like reporting your effect of your outreach and engagement activities? And is there an expectation of a feedback, reporting numbers and things like that for engagement? We're just starting to do that in our organization. But I was wondering how robust that has to be.
Yes, great question. There will be an expectation for reporting, and that expectation will be catered to that specific organization. So what we've started to do is work with organizations to develop those expectations based on capacity, based on even grant size. And our director of learning, Jane, who may be on the call, has done a great job previously at working with organizations to develop those reasonable measures and outcomes. So that will be a part of the work that happens together in partnership with the foundation.
And just to piggyback on what Jason said, even up until the point of arrival at an award, we intend to have conversation with grantees to co-design some of those metrics to ensure that they are curtailed to the particular grant in your work.
There was another question in chat about could someone define environmental justice? It seems like this could align with the health forward policy agenda if we're thinking about things like safe and healthy housing. And I don't want to define that. So if someone else from our team
I don't know that anyone at Health Forward wants to.
Or if someone from the call, Nate's got it.
I mean, yeah, and Bill, I see Billy's got his hand up too. We just had a meeting with the Environmental Management Commission last night, so that's something I've done in my off time. We don't have a formal definition for environmental justice here at Health Forward at the moment. And I do see what you mean about having it relating to the housing focus, which is in our place area. This work is primarily about our building, our power area. I think we really need to dive in on that. It's something I've talked with our colleagues about several times. Just saying, like affordable, safe, and quality housing necessarily has an environmental component, and I think there's something there. I don't think that's necessarily the focus of what we're working towards with this specific funding opportunity. But I think we can come together, circle up on that, and really have a more precise answer for that. But thanks for the question.
Got his hand raised. Feel free to jump in.
I'll just add, just because I really appreciate the conversational nature and collegial environment y'all are holding here, and I appreciate you holding space. Nate covered it very well, but just for folks interested, a Google definition is is just as helpful probably. So sorry for taking up air, but environmental justice typically defined as distributive justice, which when we're talking about the equitable distribution of environmental risks as well as benefits, but it also has a procedural thought of procedural justice, which is the fair and meaningful participation in decision-making processes that are going to impact people. Another way of saying it is that those who are closest to the problem must be closest to the solution. And so it's that's kind of taken from the US EPA's definition defined back in the 90s. But yeah, I think there's a lot, it recognizes, and it's growing to recognize a lot of intersectionality across work, so all that to say, you're doing great environmental justice work here. So appreciate Health Forward. You don't need to be you don't need to be labeled as an environmental green group to be doing great environmental justice work. So added appreciations to y'all.
Thanks for that additional info, Billy. We also got a question about, we've talked about how a lot or most of these grants will be unrestricted. So will there be specific grant dates for when the grants should be spent, and financial reporting requirements? What does that look like? If we give an unrestricted grant, it is not our intention to then turn around and ask for detailed budget reporting. If it's unrestricted, it's unrestricted. And we trust you to use it to do your work. And if we make a grant that is restricted to a specific budget, it's possible we will ask for a budget as part of the reporting for that type of grant. But again, we don't see ourselves, while that was most or all of our grants in the past, we don't see ourselves making as many of those kind of grants going forward. And typically we want to see funds spent, by the end of the grant term, but it's also, we know that things get delayed and sometimes that's not possible. So we always, no cost extensions are always possible. And it's just a matter of talking to your impact strategist to get that worked out. So I hope that answers that question. And I think we've covered all the questions that have come up in the chat. If we've missed something, drop it in the chat or chime in. And I think, yeah, given the time here, I think we'll go ahead and move forward to talk about our advocacy coalition opportunity in more detail. We'll turn that over to McLean.
All right, well, we're going to start this portion of the conversation off with another poll. Next slide, please. All right, and so this question is really intended to get to, on a scale of 1 to 10, is your organization already really formalized as an advocacy coalition? Are you all doing organized advocacy amongst a group of members? That would be a 10. If you're working in that direction, have done some work in that direction, that would probably put you somewhere in the middle. And if you've never even considered it and have no interest, that would put you at a 1. So just trying to get a feel for who all we are speaking with today. And Corey, since you can see this on the back end, I'll let you call it when you think we've gotten enough critical mass in our responses.
They're still coming in, so we'll give it a little more time here. A lot of 10s. Okay, we will go ahead and end it here so you can see the results. Again, engagement across that continuum, which is great. Quite a few 7s and 9s and 10s.
Right.
So a lot of people really invested in that work.
Well, we know that our advocacy organizations haven't had a lot of options when it comes to grant dollars in the past. And so we're hoping to occupy some of that space with our advocacy coalitions RFP. Next slide, please. So how we have defined advocacy coalitions, and I'll read: people and organizations with a shared overall policy goal, and I'm trying to move you all's pictures so I can actually read, with a shared overall policy goal who organize themselves to suggest specific policies and work to affect the policymaking process to those with the ability to change policy in favor of the coalition's shared policy goal. Next slide, please. The reason why we are leaning into this space is we would really like to empower and share power with the organizations that are comprised of members and individuals who share lived experience, are doing the work on the ground to improve the lives of the folks in our service area. And while Health Forward can and does lobby and do advocacy on behalf of the organization and on behalf of our partners and grantees, we know that in many instances, advocacy is most effective when it is done by, in the voice of, and from the mouths of the folks that are directly impacted. And so it's through this RFP that we're hoping to fund that work and really take a supporting role to the work of these organizations and lean into their work and support, and then, come to your day at the Capitol or sign on to your letter campaigns where the opportunity presents itself, while not backing out of doing direct advocacy and lobbying ourselves. And so we just want to be in closer partnership. And that's the reason behind this grant opportunity. And so, our specific reasons behind wanting to support coalitions. We recognize them as specific, powerful tools to increase civic engagement and pursue collective advocacy. We also know that these organizations are often in need of resources, that there is a lot of work going on behind the scenes to organize the various members, and that often limited resources are having to be leveraged and pooled to fund the coalition's work. And so we'd like to lend some financial support to those activities. And then we also appreciate advocacy coalitions to be a method through which individuals and individual organizations can amplify, mobilize, and empower the people that they work with, those people that have the lived experience, in order to achieve the policy changes that are necessary to improve folks' day-to-day lives. Next slide. So this opportunity is structured pretty similarly to the civic engagement opportunity in terms of sort of how we'll go about arriving at an award. We will award up to 1.5 million total in this opportunity. There's no minimum or maximum as was described previously. And also, again, dollars will be distributed in 2023 and 2024. Next slide. Our funding priorities are intended to be kept close to our policy agenda, which Nate Madden will take us through in detail, so that you can sort of make a preliminary conclusion or indication of whether or not your work aligns with our policy agenda. And again, that agenda was arrived at over the course of several months in partnership with community through surveying and conversations and community sense making sessions to ensure that the advocacy priorities and goals that we landed on reflect the needs of community as they relate to the Health Forward purpose plan and strategy. And so where we will look to prioritize opportunities is around areas described in the next two slides, one or more of the following. So it is an or it could also be an and sort of scenario depending on the makeup of your work. But we're really looking to support the work that you all are doing related to our policy agenda. And so the bullets are intended to be examples, reducing health disparities and increasing access to care, telehealth, telemedicine, equity and access to safe, quality, and affordable food as medicine and preventative care, organizations that advocate for community health workers, culturally relevant healthcare and the diversification of the health sciences workforce. Next slide includes some additional advocacy issues related to our policy agenda. I'm sorry, I'm looking at my own slides on the other screen. I didn't see that you advanced, Ross. Sorry about that. Diversification of the health sciences workforce, broadband internet access, equipment affordability and accessibility, and digital literacy skills and training, affordable quality housing and pathways to achieving and maintaining equitable and affordable homeownership, and then voting rights and the freedom of people to pursue legislative and constitutional changes through the initiative petitions and ballot initiative process. I will turn it over to Nate now, because I think the context that is needed is for everyone to have line of sight to that policy agenda if you have not already seen it, because it really provides the rationale for why we have landed in these areas. The list, though, on the previous two slides are pulled from the strategies in each of our purpose areas of people, power, place, and platform. And so these are the policy priorities and goals and really legislation that has been considered or should be considered that will advance the strategies within our purpose plan. So Nate, I'll turn it over to you.
Thanks, McLean. If we could go to the next two slides, I believe. To get on the policy agenda slide. I can touch on this really quick. Yes, it's similar to the civic engagement portion above. It's the work that we're doing and organizations who should apply should correspond to our prioritized areas, the ones that were bulleted right above. And again, these slides will be made available so that you can sort of collate those all together. And you'll notice that as we look at the policy agenda, those bullet points are very similar to the strategic focuses within our policy agenda. And we really encourage you to seek a consultation with us if you're feeling any doubt or have some questions on that. So let's dive right into the policy agenda slide. And just so everyone knows, hang on, we're getting close to the end. We're almost to the sort of last little beat here. And we'll take some last questions on this the advocacy coalition portion. And then we'll be able to you can take a little break if you need to. All right, so diving into the policy agenda piece, just one slide here real quick. And I know that Corey did drop the agendas into the chat, but I'm going to do that again really quickly if you would like to link to them. They are also in the funding opportunity announcement as well, if you'd like to familiarize yourself with them. And big shout out to everyone in Health Forward, on the comms team, the impact strategists who helped us with that work. And then also to all the people who were are either former or current grantee partners or people who are community leaders who helped inform the process of the agenda. And sort of just to go into that piece, the most recent policy agendas were developed in 2022. And we did that over an extensive period, basically starting at the end of the legislative session last year and concluding right as the year was coming to a close. So we put in a lot of time and a lot of effort into that. And it started out with, as many things do, a survey. We sent it out to over 110 organizations and community partners in our service area, with over 70 replying to the survey. Now, I think a lot of people will just say, hey, we're done. We've gotten what we need. Let's plow ahead. I don't think that's the way that things work anymore. So we endeavored to do some sense making with that survey data, and who better to do that with than the people who took the survey. So we got everyone together a couple months after we'd had a chance to dive in and digest some of the results of our policy agenda survey and brought them together in person to sort of take a look and do some community sense making of what this was, and also to dive in a little bit deeper on some other questions, specifically about how race equity is incorporated into their own policy work, as well as their overall organizational trajectory. And we also weren't able to get every single person in the room. So we made sure that we talked to as many other folks in a one-on-one basis after that meeting to glean further insights and just ask more questions and learn more. So we took our time with this process before we even wrote one word down on a Word doc to try and put this agenda together. And I think we're real proud of that, and we're also really grateful for everyone who participated and spoke with us very candidly about some of the challenges they're facing, some of the places that we could do better at as a policy advocacy partner, and just wanted to give everyone a shout out on that. They're on the back page of our agenda, acknowledged, and we're very grateful for those folks. So what shook out is that number one, our policy goals align with our purpose plan. There's no separation. You'll see that they are tight, and they are sort of there's a one-to-one correlation. And we have very sort of simple policy goals that we're seeking for each of these for each of our purpose areas. You know, in people, we're still working to ensure that people can easily access safe, quality, and affordable whole person care. In power, as we've talked about very much so earlier in the call, participation in our democracy and policymaking process improves people's health outcomes, especially since we know that civic engagement and voting are powerful social drivers of health. In place, our communities are able to be healthy places, and people are able to participate in the digital economy and build wealth through that means, as well as safe, quality, and affordable housing and home ownership. And then overall, our platform, which sort of undergirds everything and sits on top of everything at the same time, is that our community health is influenced by systems, policies, and stories that promote racial equity and inclusion. So we worked very hard to make sure that everything made sense. And we hope that it's clear to you. Also, we understand that, you know, because we sort of see this every day and we're working and looking at it every day, that you may still have questions or insights that you want to share with us, again, as it relates to this funding opportunity or just overall. So please don't hesitate to reach out and have a consultation with us. So with that, I will just open it up so we can move to the next slide and set the table for more questions about this advocacy coalition support funding opportunity. Thanks.
I'll also clarify one more time, just that the application's the same for the Advocacy Coalitions round. It's a single LOI. I know we're doing things a little differently this time, which feels weird to us and maybe weird to you too. So thanks for hanging with us. We're doing things differently, and that's we're trying to learn a lot and embrace a lot of new practices. So we, number one, appreciate your patience with us as we get some things wrong inevitably, but how we're going to get those things right is by feedback from you all. So you are an important part of us trying to do our work better. So thank you in advance for that. And
I'll echo both Corey and Nate's comments around our policy agenda and just encouragement that everyone take a look at those, particularly folks that are looking at the coalition support opportunity, but really even also the civic engagement opportunity, since both are closely married to our policy agenda. The agenda itself goes beyond just the articulation of our goals, but also includes our priorities, which I think will give you all a better sense of alignment with your respective work. And so whatever issues your organization is focused on in terms of your advocacy, just comparing those issues to the priorities in our policy agenda will give you a good sense for whether or not that type of work is being prioritized by us in this particular opportunity.
I see one question in the chat that it's just asking about if we get a 2-year grant, can grants be spent in part in 2025, since that's beyond, if we award grants in July, if it runs 2 years, that's going to be through June of 2025. And yes, absolutely. We're clearly thinking about like our annual budgets and when like our dollars are allocated and get out the door. So yes, absolutely fine to spend some of those dollars in 2025. And another question about, can you share a bit more feedback on reducing health disparities? That it can include a lot of different work. Yes, it can. McLean, do you want to take that one?
Yeah, and I'll just to sort of qualify that a bit. We talk about reducing those health disparities. We're talking about the health disparities that are experienced by our communities of focus specifically. And so those Black, brown, rural residents that we spoke of initially would be, the populations within which we're hoping to reduce the health disparity in question. There is no specific limitation beyond that. So long as it's a health disparity experienced by someone in our community of focus within our service area.
And Emily K-Mig, you have your hand raised. Go ahead.
Hi, Kai-Mig. It's no one.
Kai-Mig.
Yes, I get
Thank you. Thank you.
So my question is about okay, so working in we work in a lot of informal coalitions that are regular communication for voting rights or criminal legal reform. But my question is, if can multiple organizations from the same coalition apply, or are you expecting maybe like one? I want to know how you want to approach
Yeah,
it.
and so this sort of relates to a question that was asked about the previous opportunity. And if we're looking at both opportunities, civic engagement and coalition support, then yes, a member of a coalition could also apply for a civic engagement grant. When it comes to the coalition support grant, our expectation, or at least our assumption, is that the members of the coalition will consult with each other and figure out who's that lead organization that would apply on behalf of the coalition for this particular opportunity.
Well, thank you.
You're welcome.
And that brings up an important clarifying point, that it is allowable to apply like as a single entity for more than one if you are applying on behalf of a coalition that you're supporting. I feel like we've been a little fuzzy about that, but yeah, we do just want you to coordinate internally about who's putting that ask in. And
hello, good morning, everyone. My name is Latanya Liprin. I'm with Marlene's Kaleidoscope. Quick question. A lot of y'all know me or met me. I am new here in the nonprofit world. We focus mostly 90% on lupus. And we're getting a lot of people are saying they want to support us because we focus on one disease. Is that going to be the case here also, or is it open? Makes sense?
Yeah, it makes sense. And I would say, not necessarily, maybe, closer to no. We anticipate that, or at least we hope that we'll get a lot of interest in this grant opportunity and probably exceeding our ability to fund. And so we will, in partnership with our other teams, our people team, our
761.
our place team and our platform team, look at the universe of applications that come in and then just have to make some tough decisions from there, but keeping with that alignment with our purpose plan. This is, I don't want it to be viewed as, an exercise of futility, because it's certainly not. I mean, finite resources are what they are, but this is also a learning opportunity for us to say, okay, the need so far exceeded the amount of dollars that we put toward this, then maybe we need to revisit what we award in future rounds, or how we approach this in the future, to ensure that we're being as great as of a support in this space as we can be. And so just encourage you all in the consultations and even in your LOIs and beyond to just present, your authentic selves, and we will review and really go from there with an open mind.
Mm-hmm. And Latanya, your work in particular, we know that lupus, like there's a health disparity component to that, right? Like people of color are more impacted by that. So I think that that's another factor to consider.
And 95% is Black.
Mm-hmm.
Yeah, 95% of the people are Black and brown. So,
mm-hmm.
And it's just growing rapid. So we're just, okay, truly understand.
Yeah,
Thank you.
and yeah, feel free to connect with us to talk more. And I see a question in the chat. It's a great one. If we apply as a coalition, can more than one organization receive grant dollars? For example, there's multiple members. One org needs a portion of staff covered. One org needs money for some communication stuff. Yeah, absolutely. We expect to make the grant to a single entity that will then kind of parse it out as needed among the members. I think so. That's, yeah, absolutely. I think we've covered everything in chat. I don't see any more raised hands. We can go ahead and end if there's no more questions, but please reach out to us about anything that wasn't clear. Reach out to us about your proposals. we expect to be really busy in the next few weeks talking to all of you. So looking forward to that. And yeah, thank you all for being here and being patient with us and asking good questions and providing good input. So take care, everyone. Stay healthy, and we'll see you all soon.